Hello, my name is Prof Suzanne Chambers and I'm the Director of the Menzies Health Institute of Queensland at Griffith University. I'm talking today about prostate cancer survivorship and the importance for men and their partners getting the right sort of support after a diagnosis of prostate cancer.
I'm delighted to be here, and I know there are many people in this audience who've heard me before and who I count as friends and colleagues. So hello again to you, and hello to people I haven't met before. So my background is that I am both a registered nurse and a registered psychologist, and I've been working in research on improving care for men with prostate cancer for probably about 20 years or so now. So I come from quite a practical background, although I am a researcher. So I've got some slides that might be a little boring, so I will digress when I can to try and meet your needs. I know that we have a mixed audience, some people who are new in their cancer experience and some people who are down the track. So it's a bit of a mixed talk. Let's see how we go, and I'll be very happy, of course, to have questions at the end. Okay, so as a researcher and a healthcare practitioner, I think what's important to all of us in the research world and to the Prostate Cancer Foundation of Australia is knowing that the prostate cancer challenge is huge going into the future. Prostate cancer is just as common as breast cancer, and men typically do live for a long time, which is great news. But what that also means is we need to be looking after all these men, giving them the very best of care, and looking after their partners and families as well. And that is the challenge that I work on in combination with the Prostate Cancer Foundation of Australia and my other research colleagues. Now, I want to do a little bit of a disclaimer about using the term cancer survivor, because not everybody likes it. Some people think of themselves as I'm just a person who's had cancer. Some people do relate to the idea of being a cancer survivor, and other people think of themselves as a patient. But it is a term that is used in the field and by funding bodies, so we tend to pick that up ourselves. And the technical term for cancer survivor is simply anyone who's had a diagnosis of cancer at any time in their life, and those people who are closely connected to them. It's a pretty broad definition, as you can see. And so what that means is, in a way, I would be surprised if there was a person in this room who couldn't be defined as a cancer survivor, because most of us will be connected closely to someone who's had a diagnosis if we haven't had that ourselves. So we're a pretty broad group, and there's a lot of us. The important thing to know about cancer, and so many of you in the room have had a diagnosis, so you know this better than anyone, is that it does tend to change your life. And it does tend to change the way you see the world for good in many ways. And it affects the life of those close to you. And so even once you've gotten through that initial understanding the diagnosis, making decisions about treatment, there are long-term implications that people need to think about for their own well-being and for their own future. And so the importance of that for me as a researcher is that when I'm looking at how do we support men and their families, I'm interested not just in this at the point of diagnosis, but also down the track, years down the track. And in fact, our research follows men typically for 10 years, and partners for 5 is the work that we have done. This is a little bit academic, but this comes from some work that is globally known, published in a very important journal. And it takes the idea that maybe it'd be useful to think about cancer survivors as what happens to them in the acute stage where they're close to diagnosis, and then what happens in the medium term and then ongoing. Probably the main point is just to say, again, reinforce that point that this is a journey that starts at diagnosis and continues on, and it's important to be thinking about taking care of yourself. And this, when I say taking care of yourself, I mean partners and family members as well as patients. And understanding that there might be late effects from treatment that you want to be aware of, and that means you want to be thinking about long-term, how are you going to look after your health. And I particularly throw in here, this is where I start to diverge and go off track a bit, but prostate cancer does occur in our lives later in life, where we're also at risk of other illnesses like heart disease and other things. And the news about what you can do to look after yourself for prostate cancer is pretty much the same as what you need to do to look after yourself for these other potential illnesses of ageing. So the recommendations we make about looking after you and your partners as well counts for all of those things. So when we think just about men with prostate cancer, what we do know is that people are pretty resilient, men are pretty resilient, and so are their partners. So by and large, men cope well with a prostate cancer diagnosis, and their partners do too, and they get on with life and they get through treatment, and even when the cancer recurs, if that occurs, they're pretty good at managing the stresses that are involved in that. But having said that, there are specific things that can happen that you can do something about. And that's what we're interested in. What can we talk about where we can improve things for you? Because while most men and their partners cope well, there will be a subgroup, perhaps 1 in 4 or 1 in 5 partners, as well as patients, who can experience depression and anxiety and heightened distress. And it's important to deal with that and to get help with that, because there are no medals for suffering, and if you're not doing so well, it's important to put your hand up and go, okay, what is the evidence about what I could do to help myself with that issue? And the same thing for partners as well as patients. We also know that, like most men and women ageing in our community, we have high rates of what we call comorbid illness. So what that means is just extra problems associated with ageing, such as not getting enough physical activity, being overweight, perhaps not eating as well as we should, not looking after our mental health. So these are all things that I'm saying to you, you might want to give this some thought about, okay, I've got this diagnosis, I've got to cope with it. What other parts of my life could I look at to help me cope with this situation, but also help me have better health in the long run? Because we know from all our research that there is this subgroup who do quite poorly, and even when men are doing well, they'll still have, and wives and partners, they'll still have episodes where things don't feel so bright. The idea is, how can we help with that? The particular problems that we have that men typically face after prostate cancer are sexual problems because of the treatment. There are others, of course, but that is a prime one. And also, on some treatments, an increase in problems with obesity or with lack of exercise. So we've got some specific target areas that we know we can do something about and we can help men with. And we're interested in doing some work on that. This is a particular study that we've only just published this year, and this is a group of 1,000 men with prostate cancer that we actually followed over 10 years, and we're still following them. We don't have 10-year data on all of them yet. This is the 6-year data, and what we see from this is that there are things that put you at risk for having more trouble, more coping difficulties and more distress. And so it's tougher when you're younger, it's tougher when you don't have a partner to support you, it's tougher when you're under financial stress at the same time. These are things that, if you're in that situation, you can go, okay, this might be a bit tougher for me. And we also know that problems with urinary bowel and sexual function, which can occur after treatment, are also related to poorer overall quality of life, so feelings of well-being. So it's important that we target these things and we do something about them. Interestingly, in this study that we did, what we didn't find was that being anxious about PSA testing was predictive of poorer outcomes, which some of you might be surprised about, because you might think, I get really anxious when I have my PSA test. But I think what that seems to be is you can be very anxious about your PSA test, but once it's done, men often are pretty good at putting it out of their minds. So the issues are, as I have discussed, we know that there are times when people are feeling really stressed and they need some help with that, and there are some people who stay really stressed. We know that often men report they don't get enough support. Now we know, and I'm going to launch into some generalisations here, because you're blokes, you often don't want to ask for help. Now that's a bit of a generalisation, but it does occur in men's health. And so sometimes we need to prod you and poke you a bit to say, if you're not doing so well, you need to sing out and get some support. What we also know is, despite a lot of the work that we've been doing, things seem to have plateaued over the last 10 years, so we think we need to do better. Just very briefly talk about masculinity, and this links to the comment I made before about often men do not seek help, and that is a fact. We know from looking at the data that cancer helplines and all those services are much more often utilised by women than they are by men. And often for men with prostate cancer, the partners go out looking for the information for them. Is that, ladies in the room, an experience? I'm looking for nods. Ladies, I've had a few nods. And that's just the way we are in society. It's not a good or bad thing. But what that means for us as researchers and people who are trying to provide services, that we're interested in finding out about how to make things more accessible for you. I think what's interesting in prostate cancer is that we know that support groups can be really important, and often men feel quite comfortable in going to a prostate cancer support group and discussing their issues with other men. And I would encourage those of you in the room who are feeling like it might be helpful to chat to someone, to talk to people from the Prostate Cancer Foundation of Australia here at the desk and find out about prostate cancer support groups that are near you, because there's, I think, Anthony, 177 or more than that across the country. And I've worked closely with prostate cancer support groups for a long time, and I think they're pretty marvellous. For us women, I suppose it's important for us to be aware that masculinity is very central to men's response often to prostate cancer, and it's a challenge for us sometimes to understand that and learn to help. So these are the barriers to help seeking in men. Masculinity can be a bit of a barrier. Sometimes the services aren't very easy to access. I think that's where support groups can be really important. And sometimes the service providers aren't great at telling you where the services are, so we need to do something about that as well. Now, we do have a bit of a problem with some of the research in this area at the moment. It's been quite biased, and what they've often not done in the research on ways to help is looked at what men will actually use and access. So we've been working hard on that to try and get services that will be better for you. I'm going to flip through some of these because I don't think they're probably what you want to hear about so much. So we've been working on all of this area for a long time with the support groups and with the Prostate Cancer Foundation of Australia. And about 4 or 5 years ago, the foundation came to us and said, we think we really need a centre of excellence and we want to work on that with you, Suzanne, and your partners. And so we started doing that with just some very basic support, and we were fortunate enough last year to win a National Health and Medical Research Council large grant to establish a Centre for Research Excellence in Prostate Cancer Survivorship. And I'm just going to very briefly overview that for you so that you know what we're doing in the area and that we're onto it and working hard on your behalf. So it's a big team of investigators. This is the team of chief investigators from across the country, and we've got epidemiologists and exercise physiologists, psychologists, endocrinologists, urologic surgeons, medical oncologists, all sorts of folks who are part of this team. And there's also a team of associate investigators, and some of those people, like Anthony Lowe, are actually in the room right now. So we've got 20 investigators all up, and we're national and we're global. In fact, we have people from overseas involved as well. So we have 4 areas that we're focusing on, and we picked these because there's lots to do, but we need to be addressing the areas where we think there is the most to be gained. The research theme that I look after is psychosocial and sexual care in prostate cancer. We have a theme on tailored exercise medicine for men with prostate cancer, and that's led by Rob Newton and Daniel Galvao, our colleagues at Edith Cowan University in Western Australia, who some of you will know about. Have just shown me data to show that they have done the most work, published work in prostate cancer and exercise globally. So we've got great people that we're working with. We're very lucky in Australia to have these folks around. We've got health economists who are working with us on looking at how to make this care available and cost effective, and that's led by Paul Scuffham, who is at my university. And then we're doing work particularly looking at our rural and regional men. That work is led out of both the Cancer Councils and the University of Southern Queensland. We know that men who live in rural and regional Queensland get diagnosed with more late-stage cancer, prostate cancer, and they have worse survival. So we are very keen to understand the reason why that is so and improve care for those men, because it seems outrageous, doesn't it, that in Australia, such a well-developed health system, but we've got disadvantages happening in our rural and regional areas for men and their families. So this is the work that I'm doing on psychosocial outcomes for men with prostate cancer and their partners. And what you can do, what my advice is about things that you can do, because I know that many of you are just facing prostate cancer for the first time. So early on, very confusing, being asked to make decisions about treatment and not being told there's one right way to go. So the best way to approach that is to take a very problem-solving approach, understand the pros and cons. You can do things like has been suggested to audio tape your interactions with your doctor, take a second pair of ears along. Remember, you're the person that matters most. Get a second opinion if you want to and take your time with that decision. There is rarely a need to rush, and coping with prostate cancer or any cancer, it takes time to think it through and to work out what your priorities are. Your care is about what you want. Be aware of your mental health. It's normal to feel angry or anxious and all of those things when you're going through this experience, but if that persists over the long term, it's important to think about getting some help with that. And we know that there are a range of strategies that can help you with that. You can learn stress management techniques. Understanding what's going on can be helpful as well. There's lots that we can do. And in any treatment centre, there should be a nurse or a social worker or a psychologist who can help you with that. If you do nothing else, do exercise, but get tailored exercise. It's very important to do exercise that counts. You can be walking and doing all sorts of things and not really getting the proper benefit if you're not getting it targeted to what your needs are and what your treatment is. So exercise physiologists know how to do this, and you can get a tailored plan that addresses your general health, your levels of exercise, and the sort of treatment that you're having. Talk to your partner. This is a tough experience for anybody, and it can be very isolating. And often what happens in relationships is that you each start protecting each other and then you stop talking to each other about what's going on. It doesn't mean you have to talk about cancer all the time, but talk about it some of the time and work together as a team. If you need external support, go to a support group, get help from somewhere else. So this is a book that I wrote a couple of years ago, and the author royalties go to the Prostate Cancer Foundation of Australia to support research. It's available on Amazon, and it's got a series of chapters where I've written down all the things I've learned over the years about how to cope effectively with prostate cancer. So you can get it from the PCFA, you can get it online, and the PCFA have developed iPad apps and Android apps that go with that. There are also DVDs and lots of resources around for exercise if it's hard for you to get that level of help. Now this is where I get to do a plug very, very quickly for a study that we're doing. So as I said, one of the things we're really interested in our centre is looking at how to help men with the consequences of prostate cancer. This is the study that we're doing across Ireland and Canada and New Zealand and Australia, and we're still recruiting for this study. It's an online research project that you can be involved in, and we have cards that tell you how to enrol in the study should you want to do so, sitting at the PCFA desk out front. We've got 720 men in this study so far, so help me get to 800. Help me get a round number, that would be tremendous. So I'm going to stop talking now because I'm sure I've been going on for 4 minutes. But I just want to say, lovely to be with you. I'll be around at lunchtime and I'll be very happy to take questions, Julie.